Hi, I'm Dave Boyland from Goldwyn and Boyland Physical Therapy, and we're again here in our McGraw office with Tim Bennett from the Cortland Voice. And today I want to talk about a little different topic, but kind of similar to what we talked about before. So we had done a little bit of a series on pain, about how pain's not a thing, about how pain has a direction, and that pain's a process. But actually very similar to that, we see patients who will come in with what are called essential tremors. And they often are told that there's really nothing they can do about essential tremors, that it's something that they potentially can take medication for, but it's something that just happens in the body. But what I want to inform you today is the fact that even though our body creates tremors, the question is, why does it create a tremor? So it's interesting that they're called essential tremors, because ultimately the word means they're necessary. Well, why are they necessary? Well, they're necessary because actually over time and through stress and trauma and a lot of different life experiences, our body collects those experiences inside of us to the point that it starts to become overrun, too full. So one of the ways that the body can actually begin to eliminate that stress energy is to actually tremor, okay? So my tremor doesn't have to be essential, but my body's ability to get rid of that energy is essential. And that's the disconnect that oftentimes patients struggle with. Because, for example, if I have an essential tremor, it will happen with intention. So if I'm going to write a check, if I'm going to feed myself, if I'm going to change the station in the car or change the volume in the car, then my tremor becomes really apparent, which again makes it even more stressful and more frustrating, which feeds the body's need to tremor. And so it does become a pattern, and it is something that potentially they could become chronic or they could live with for the rest of their life. But the good news is it doesn't have to be chronic, it doesn't have to continue on, and it actually can go away with tools that we'll use to teach patients exercises and other things that allow their body to eliminate that energy. Just like our body can eliminate pain, it can eliminate other kinds of energy, it can eliminate stress and reduce the stress load on the system. When it does that, then the need to tremor gets less. And then the patient is actually able to do things better. That stresses the body less, and then the tremor can actually go away and the body can reverse the process. Unfortunately, what happens in conventional medicine is these individuals, these patients, would be given medication to suppress the tremor so that they can live their life more normally without having the tremor be so prominent or interfere so much in their activities of daily living. Well, in functional medicine or integrative medicine, the question would come up, where's that energy going then? If it's still in me, then I'm going to need to take that medication for the rest of my life or chronically to maintain my body's ability to not tremor. Well, that creates a disconnect. And so again, all we're offering patients is an opportunity, whether they're on medication or not on medication, to learn different tools, different interventions to be able to eliminate the tremors, restore their life, restore their activities, and those kinds of things then set the body in motion to be less stressed. And so again, as we all strive to experience less stress or more emotional balance in our life, having things like tremors can really interfere with that. So we just look forward to the opportunity to help any of you who might be struggling with this, or a family member or friend. And so again, if you could just get the word out, or even comment below and we can contact you, we would be glad to. But again, anything that your body is doing that it didn't do from the beginning, if it started in your lifetime, it can end in your lifetime. And that's the message that we just want to continue to put out there. So again, we appreciate the Cortland Voice, we appreciate these opportunities, and we look forward to talking about other topics in the future.